We could learn in the next few hours Michael Jackson's official cause of death. An autopsy is planned for this morning. It's actually supposed to start just moments from now. Michael Jackson is believed to have suffered from sudden cardiac arrest. It is the leading cause of death in this country. It kills more people than breast cancer, lung cancer, and HIV/AIDS combined. And it can be the result of many things: abuse of prescription drugs, diet fads, stress, age. Joining us now is Dr. Jake Deutsch, who's from the Hackensack University Medical Center. He's an ER doctor, and we're glad you're here. This story is good morning to you, sort of right up your alley. When a patient comes into your hospital having suffered from sudden cardiac arrest, what are the first things that go through your mind?
Well, we're really trying to figure out what instigated the situation. A sudden cardiac arrest talks about problems with the heart and particularly how it's beating. So something instigated the heart to go out of control, beat irregularly, and what happens is there's not enough blood flow to the vital organs, to the brain, to your kidneys, to your lungs, and that's what ultimately causes death. We have a list of things that we always are thinking about as a potential cause. Certainly trauma, stroke, blood clot to the lungs, overdoses. Those are the things that we're trying to reverse quickly and assess in order to bring a patient back if they're in arrest.
We've heard that Michael Jackson had a physician in his house in Los Angeles who was there on call, presumably 24/7. I mean, the fact that he had a doctor there at the time that he went down. Tell us about the amount of time from the time that someone suffers from sudden cardiac arrest to the time that they receive medical care, and whether or not he actually could have been saved.
Sure. Well, obviously time is of essence. If your heart isn't beating properly and you're not getting blood to your brain, every moment counts. When somebody has an irregular heartbeat, one of the best things that we could do is defibrillate a patient. So you know the electrical shock that you receive from a defibrillator, that given immediately can cause people to react and get better very quickly. Other things that need to be done is reversing things that potentially are causing the arrest, such as an overdose, giving an antidote for the narcotic, treating somebody who's hypoglycemic, giving them blood sugar. But you need to have equipment. You need to have medications that you can give rapidly. You need to have things to help somebody breathe, maybe be able to put them on a ventilator. So being in somebody's home and trying to do these things sort of spontaneously is not an easy situation, and it makes me wonder, what type of training does this doctor have? Are they a psychiatrist? You know, are they an internist? Certainly what I do in emergency medicine is take care of these problems all the time, and that's what we're used to and expert at, but we're not doing it in a living room with terrible circumstances. We have a very controlled environment, and we have resources in order to make the best outcome.
It's tough to speculate, and a lot of times we get burned in our business when we do that, but in this case there is so much anecdotal evidence that Michael Jackson was taking a cocktail of prescription drugs, antidepressants, painkillers. The latest report this morning from TMZ.com, which has been right on the money as far as the facts of this story so far, is that he received a dose of morphine in the last couple of days. Tell us about what all those different drugs, all at the same time, could do to someone's system.
Well, drugs have terrible interactions and side effects when not being used properly or under the medical supervision of your physician. Certainly the narcotics, the morphine, is a big red flag in my book. If taken in a massive amount, it could cause respiratory depression, makes you stop breathing. That causes the cardiac arrest. So that would be the first thing that I'd be concerned about. Also, mixing medications, it's very difficult to get people to a stable level, and there's certain interactions that happen with particularly the antidepressant medications that he may have been taking. So this is, a recipe for disaster. We saw it with Anna Nicole. We've seen it with other celebrities.
Heath Ledger, also an accidental overdose, apparently.
Right. I mean, this is incredulous that there's a physician that potentially could be instigating this type of drug abuse, but nobody's going to know until they have an autopsy, until the facts are really laid out on the table.
What do you think we're going to hear this afternoon?
That's a tough one. I mean, certainly they need to be doing blood tests to look for toxicity and other medications. They need to be looking at vital organs like the heart to look for any structural problems, the brain for brain injuries and strokes, the lungs for blood clot. I mean, this, to me, smells of an overdose, but certainly there's a lot of potential here.
Jake Deutsch is an emergency room specialist at Hackensack University Medical Center in New Jersey. Good to see you. Thanks very much for coming.
Thank you.
Megan?
Update for you now on the other headline.